Dr. Tim Kolbaba. I'm a chiropractic physician. I've been a chiropractor now for about 3 years. A lot of times people ask me, how did you get into chiropractic? Well, it's simple. I was in the United States Marine Corps, and I went through some training where they broke my neck. I went to the hospital where they told me I was going to have $50,000 worth of surgery, and that was not an option for me. So I had heard that there was a chiropractor on base. And I am from a chiropractic family. My dad is a chiropractor, my uncle Dana is a chiropractor, and my cousin Brian is a chiropractor. So I decided to go to the chiropractor on base and get a second opinion. He told me he would get rid of my headaches and fix my neck within 6 to 8 weeks. So I went to him for 6 to 8 weeks, and sure enough, I didn't have a headache anymore and my neck pain was gone. So I knew when I got out of the military that I had to become a chiropractor and help people who had similar injuries to me, so that they had an alternative way, other than surgery, to get rid of their pain. So what is chiropractic? Simply put, chiropractic is a non-surgical, non-medication oriented way of treating the body and allowing the body to help heal itself. We use lots of different techniques such as Graston, such as chiropractic manipulative therapies. We also use things like acupuncture and a whole array of other things. So why do Americans in particular suffer from low back pain? Well, a lot of times it's ergonomics. Simply put, when you're at work and you work at UPS, you probably, if you're going to lift the boxes and do it the same way over and over and over, you better be doing it right the first time as well as the whole day. The second you have bad ergonomics, you'll have a low back pain that usually results in you either having to have surgery or you having to see a chiropractor. A lot of times, too, in my office, we see a lot of athletes. And this is because in high-end or high-impact sports such as soccer, football, basketball, a lot of injuries occur like sprained ankles or back injuries or neck injuries. So these type of patients come into my office and get treated. Now, besides acute injuries, a lot of times we will see the elderly. A lot of times these particular people have had long lives full of bad ergonomics at their jobs, or have lived lives that are very hard on their bodies and had bad habits. So a lot of times when we see these people, we're treating chronic conditions as well. So when you see grandma and she's leaned over and her back hurts, a lot of times those type of people come in and see me. So on average, right now I see between 5 and 10 patients a day at the office I'm currently at, as it is a new office and I have been there a very short time, about 6 months. I have seen at my other office, before I worked here, anywhere from 30 to 50 patients in a day. And it can be done and done well, and usually most people are pretty happy with the care that they get there. Now, the question is, can chiropractors prescribe medication? Well, the answer is not in Illinois. However, in Nevada and New Mexico, chiropractors are able to prescribe some NSAIDs as well as some muscle relaxers to help aid the patient in getting better. Now, another question too is I've asked is, what are the pros and cons of chiropractic? Well, some of the pros are it's really fun, you're hands-on, you get to deal with a lot of people, and the number two pro is you feel good about yourself helping people who maybe would have to go down the surgical routes. They find another way to deal with their pain by coming to see someone like me, where they will get things like PT, rehab, chiropractic manipulative therapies, and usually we can get people feeling pretty good. But not everybody is a patient for chiropractors, so the only way we can determine that is through an exam. Now, where is my business located? Well, simply put, my business is located in Bedford Park, and this is our website. My office is called Reflections of Health Integrative Care Center. And we have a couple of websites here, and this just goes through all the different services that we offer. And some of the services that make us unique are things like acupuncture and massage. So we have quite an array of different people that work for us, as well as chiropractic, and we also do such things like infant massage or pregnancy massage, which seem to be very popular in today's society. And they also help with such things like decrease labor as far as number of hours, or decrease the pain of labor. So it's very important, as well as to help women with their low back pain during the pregnancy as well. Now, the question that I'm always asked is, what are some funny or weird stories about chiropractic? Well, there are quite a few of them, and it's hard to choose just one. But I gotta say, my favorite one is probably, it's definitely gotta be everybody poops and everybody farts. That's the reality, people. So sometimes during the course of a treatment, somebody's face down, I'm treating their back, all of a sudden old grandma rips one. Sometimes it happens, and as a chiropractor, sometimes it's hard to pretend like it didn't happen, or be like, act like everything is okay when you're trying to hold your breath because it smells in the room. But rest assured, we have air fresheners in every room, which help to take care of the smell. So um, we have a lot of fun with some of the elderly because they can't help it, and we just laugh about it. When you get to that age, you just don't care anymore. You just let it go. So hopefully you've learned a little bit about chiropractic and what we do. And if you know anybody who needs a good chiropractor, that might be me if you're in Bedford Park. So it's good talking to you, and have a wonderful day.
This is the story of a girl who cried a river and drowned the whole world. And while she looked so sad in photographs, I absolutely love her when she smiles.